on Tobago Updates. Viewers, we are continuing our conversations this morning and we're switching gears away from tourism and into some World AIDS Day and the 16 days of activism against gender-based violence. So we are being joined by Miss Yolanda Simon online, and she is the Vice Chairman of the National AIDS Coordinating Committee, as well as Mr. Cyrus Sylvester, who is a peer navigator for the National AIDS Coordinating Committee. Good morning and welcome to you both. How are you guys this morning?
Good morning and thank you for having us.
All right,
Good morning. Thank you for being here.
Great to have you. Now, I want to get things started off with let's talk about the state of, HIV/AIDS in Trinidad and Tobago. Now, it's no longer a part of the headlines like it was in the 90s and in the 80s, but it's still something that's of serious concern, especially for our little nation. So can I just get a perspective from you guys as to, what's the state with AIDS and HIV in Trinidad and Tobago?
So, with respect to the climate where HIV is concerned in Trinidad and Tobago, we are working assiduously towards reducing the number of HIV cases. Testing has been ramped up throughout the country. There are testing sites throughout the country where persons can be tested. There's further information I will give, but I think I want to hold that for a little later. But with respect to HIV, we are encouraging persons to get tested. It is important that you be tested because the only way to find out if you are HIV positive is to do the test to know your status. If you are found to be HIV positive, then you can go on to be treated.
So, Ms. Simon, what are the numbers like in Trinidad and Tobago? What is the data telling us at this point in time?
Good morning again. Well, the data as of last week, there was a presentation by the technical director of the National AIDS Coordinating Committee. And at present, it is estimated, and that's important to remember, estimated between 10 to 12,000 persons living with HIV here in Trinidad and Tobago. We have seen a decline in the mortality rate, which is good. But as Cyrus said, HIV is still around and people need to get tested. So the data is showing that the science is working, that those who are HIV positive are on treatment. There is a lot of adherence, could be some more, but we're working on that. But the data is showing us that we are really going in the right direction. And certainly, we are within striking distance of meeting the targets of ending AIDS by 2020.
Certainly. Now, I know that with the advances in medicine and so on, it has helped a lot of people be able to live with HIV and AIDS, and that has contributed to the reduction in the mortality rates and so on. But as the cases themselves, are we seeing a higher prevalence of cases or lower prevalence of cases? What's that situation like?
Perhaps we need the medical professional to speak to that. But from where I sit, the cases are reducing. We are not seeing as many persons, presenting with HIV, but still HIV is still here with us, and persons are still being infected.
All right. I don't know if Mrs. Simon, do you have anything else to add to that?
Yes. In addition, I quite agree with Cyrus that we would leave the numbers to the medical professional, because Cyrus and I are really coming here. I wear a number of hats, but today really, given the theme of World AIDS Day, Let Community Lead, we are really looking through the lens of community and how community voices have supported, impacted, and have become a critical part of the response here in Trinidad and Tobago. So we are not into crunching the numbers per se, but really to give a reflection of what over the last 40 years, because it's been 40 years this year, that HIV has shown its head in Trinidad and Tobago, and what that has meant and how that has impacted at the community level.
All right, and then as we're on that now, let's talk a little bit about just some of the achievements that has come about since the organization started, since you've begun the work here in Trinidad and Tobago.
Now, with respect to the achievements in HIV, there are numerous achievements in HIV. One is the successful expansion of the PMTCT service. This is the prevention of mother-to-child transmission, whereby pregnant mothers who are found to be HIV positive, they are started on ART, antiretroviral therapy. And with successful introduction of ART, these mothers go on to, the HIV is reduced tremendously during pregnancy, during childbirth, and also during delivery. There are other successes. For example, the HIV helpline has been re-established, 800 for HIV. The helpline is there to support persons both infected and affected. There has been ramped up testing throughout Trinidad and Tobago. There are many, many public testing sites where persons can go and be tested, and testing is free, and you can have your results within as little as 15 to 20 minutes. HACU, the HIV/AIDS coordinating unit, they are in the process of onboarding persons who provide support for patients. For example, they're in the process of employing and rolling out psychologists, medical social workers, care navigators, patient tracers, field investigators. All of these persons are coming together to support persons, during their continuum of care. There's a lot of outreach taking place as well, where we go into the communities to do sensitization training, because it is important that persons be aware of HIV, how it is spread, how it is not spread, how they can protect themselves. With effective antiretroviral therapy, persons go on to become virally suppressed, or as we say, U equals U, undetectable equals untransmissible. And what this means is once you have achieved the viral suppression, you cannot pass on HIV to any of your partners. But in order to remain undetectable, you have to remain on your medication. There are lots of other achievements. For example, there is now the policy to treat all. Once you are HIV infected, you are immediately started on treatment. At the healthcare facilities, there is opt-out testing where persons are offered an HIV test. Regardless of what you come there for, you are offered an HIV test, and you have the option to accept or to refuse. And all of this is a part of the process to get persons to know their status.
Now, Ms. Simon, can you give me an idea of, how has that community response been like in terms, especially when we look at just the history of, AIDS and HIV in the country, that stigma and discrimination that it attracted in our society? Are we finally to that stage where we're seeing where, people are just a little bit more understanding and, it isn't that big of a stigma attached to it amongst the community as there once was?
This is a very, very interesting question, and it comes in a good time following Cyrus's letting us know all the wonderful things that have been happening in Trinidad and Tobago. The not so wonderful things that's been happening is that the ever familiar stigma and discrimination remains the major barrier to treating HIV and AIDS as we know it here in Trinidad and Tobago. When we started this, when I say we, when Trinidad and Tobago, the first case of HIV in Trinidad and Tobago was in 1983. And here we are 40 years later, and we are still having to grapple with stigma and discrimination. And because stigma and discrimination really is not a facet of HIV, it was here long before that. What HIV has done, it has brought stigma and discrimination to the forefront. And whilst it's wonderful that we have had all these achievements, we've had the vaccine, we've had free medication provided by the government since 2005 to present. People are being virally suppressed, people are adhering to their medication. But what we really need, and we still need today, is a social vaccine, because there is still so much stigma and discrimination. Fortunately, as Cyrus and I sit here, because we've been on this journey for a long time, involved in HIV and AIDS, but say, we have been seeing, and we've seen that there has been some progress, albeit small, but progress, no doubt. I mean, just the fact that we are on this radio program and we are discussing HIV and AIDS, I mean, it's a huge step. Many, many years ago, the media portrayed HIV and AIDS in the most derogatory terms, I have to say. They were just coffin and crosses and AIDS killed. Today, we don't even talk about AIDS. Today, we talk about HIV, people living with HIV, not HIV and AIDS, just living with HIV. So we've come a long way. We still have some ways to go. Again, progress in terms of media sensitization. Again, here we are with the media. The media who long ago, Cyrus would tell you, we would not even speak with the media because all they were interested in was sensitizing, but sensationalism, with all of these terrible headlines, really, really. But now we can have a conversation, a real conversation about what's going on and how to treat for people who are living with the disease. Also, today, I mean, since 2009 and then 2013, at the level of the government, there is the HIV Workplace Advocacy Unit, whose role is it, whose mandate is to look at reducing stigma and discrimination for persons living with or for workers living with or affected by HIV and it's in the workplace. So a lot of good things are happening and we need to continue these things to happen. What we need, a couple of things very quickly, we need to continue the investment in people living with HIV and those affected by HIV until we get to that place where that social vaccine, where HIV will become, just a medical chronic disease per se. And also, we need the entire public to begin to realize that HIV is not about, it's not a responsibility of the Ministry of Health or the National AIDS Coordinating Committee or the National AIDS Secretariat, but it's all our responsibility as citizens in Trinidad and Tobago to treat with our brothers and sisters in a humane way. And when we do that, we'll begin to break down those barriers, and then HIV will no longer be what people perceive it to be, but it would just be just another chronic disease.
Now, another mission of the National AIDS Coordinator Committee is that of documentation, especially of the last 40 years of being in existence. How is that process going and what are the goals in mind in the near future?
With respect to
Okay,
the
so
documentation of HIV in Trinidad and Tobago, as Ms. Simon said, our first HIV case was detected in in what in
1983.
2000 in 1983. Sorry, yes, our first case was detected in 1983, 40 years ago, and it is important that this be documented. It be documented so that future generations will know where we came from and where we are going. Because if we do not know our history, we are doomed to repeat mistakes going forward. Also, it will be a platform for future generations to know what were some of the challenges that we faced and the successes, the achievements that we that took place to bring us to where we are today.
Because at this point in time, we're also recognizing, observing the 16 days of activism against gender-based violence. And I want you guys to speak a little bit towards incorporating this, World AIDS Day and just this sensitization about it, together with the 16 days of activism.
Now, there are many persons who belong to key populations. There are many persons who belong to key populations. And to tie in a question that was asked earlier with respect to the community involvement, because of widespread stigma and discrimination, a lot of persons from these communities, for example, sex workers, male and female sex workers, the population of men who have sex with men, underage boys and girls, migrants. A lot of these persons may face stigma and discrimination when attempting to access public, testing, treatment, and care. And for these reasons, there are lots of NGOs on the ground, community organizations that are now coming on board to bridge this gap in the provision of healthcare, for services to these members of key populations. So it is very important. It is very important that the communities become involved. And with respect to the 16 days of advocacy, a lot of these persons face violence. So, we are tying in, treating with these persons, providing services for these persons, whereby these persons they can receive treatment and care in a comfortable and friendly environment.
And Miss Simon, I didn't know, and I think you wanted to add something.
Yes, a couple of things, if I may add to what Cyrus has been saying. Where there is vulnerability, there's violence. They seem to be inextricably linked. And it is interesting that Woolits Day would fall kind of smack in the middle of the 16 days of activism. And notwithstanding what Cyrus has said about these vulnerable communities, people living with HIV and AIDS is also a vulnerable population. And within that environment, there is a lot of violence, which remains silent for the most part, and for a number of reasons. Even when people report violence, the reception they get from the authorities is not a good experience. And so there is a measure of intimate partner violence. Of course, we know in Trinidad and Tobago we've been trying to address gender-based violence and violence against women and girls for so many years, and it remains still one of those things that we continue to work assiduously, plugging away, and we will continue to work on it. But we have to acknowledge that again, some things need to be changed because whatever formulas that obtains today, we're still missing the mark. So it is interesting that the 16 days of activism, which spans a whole slew of things. Yesterday it ended because yesterday was Human Rights Day, and
Yes.
again, it's a whole. It's an interesting 16 days really for communities and the body politic to come together and come together in a real way, not in a superficial way, just to acknowledge the days and count down the days, but really to come together and work with a plan of action that is measurable down the road. So next year, this time when we're having a conversation, we can say, yes, we would have achieved A, B, and C, but we still have to go to X, Y, and Z. And I think that's the conversations that I'm not hearing. Um, yes, we're hearing, let's do this day, it's World AIDS Day, we talk about gender-based violence, we talk about Human Rights Day. But after the days have gone, what happens between now and the next time we're commemorating these days? And so those are some of the conversations that we need to have. And I'm happy to say that I think very, very early in the new year, there's going to be an entity coming up which is going to be asking these hard questions. I'm not going to give anything away. But I don't know if it's fair or if it's just people are probably a little wary because HIV has been going on for so long, and there's been a lot of boots on the ground on the front lines, and perhaps people are getting a little wary. But hence the reason why we need to get more people involved, because this is a journey that continues, and
Yes,
really
certainly.
we need more people to get together and join this. I'm not calling it a fight. You say it's a fight. It's not a fight. It's a movement towards ending AIDS as we know it in Trinidad and Tobago, but globally as well. And we can do it here in Trinidad and Tobago. We have the means. We just need people to be committed for the long haul.
All right, and I want to get into those conversations just a little bit, even just about the experience of some of our citizens who are living here with AIDS, as well as the experience of like the organizations and so on, in working with the communities to make this a better situation for all of us in the country. But we're going to get into those conversations just a little bit because we got to take a quick break, and then we'll be back with the National AIDS Coordinating Committee. So don't go anywhere.
Morning, Tobago.
Oh, welcome back to Good Morning Tobago on Tobago Updates. Viewers, we are continuing our conversation this morning with Ms. Yolanda Simon, who is the Vice Chairman of the National AIDS Coordinating Committee, as well as Mr. Cyrus Sylvester, who is the peer navigator for the National AIDS Coordinating Committee. And welcome back to you both. But as we continue our conversation this morning, I want to speak a little bit about the community effort, because I guess this is something that I have also been quite passionate about, because since I was a teenager, with my dad, working amongst, we had a few organizations here in Tobago, such as the Oasis Foundation, the Friends of Oasis Foundations, that worked with people that had, that were dealing with the disease. And at a time when the stigma and the discrimination was pretty high, but what's been the journey like in terms of working with the NGOs that are there trying to assist the community, and trying to give support to those people who are afflicted by the disease? And either one of you could take this.
So it has been
Shall I
recognized
start?
that
Okay, you can go ahead.
Cyrus, you go ahead. Go ahead.
right. So that it has been recognized that these populations exist, and they have been deemed the most vulnerable. So in order to reduce the incidence of HIV, a lot of focus has been placed on preventative measures targeting these populations. Over the years, in the early years of HIV, a lot of NGOs, we saw the birth of a lot of NGOs providing support and other healthcare services targeted specifically for these populations. Because HIV is now at a place now where it's considered a chronic manageable condition, the focus is not so much on HIV anymore, because as you yourself said, a lot of persons are hardly speaking about it anymore. But HIV is still with us. So the work still has to continue. The awareness must continue. The sensitization still has to continue. But there are still NGOs on the ground who are actively doing the work. Yes. For example, there's the Family Planning Association. They're still actively working with populations, and more so with the migrant population, because we have to appreciate that a lot of these migrants, they come here and for different reasons. For example, stigma and discrimination. Some of them may be afraid that, if they're able to access healthcare in a public setting, they may be detained and deported. So to bridge that gap, NGOs such as the Family Planning Association, they are meeting the needs of this population. There are also other NGOs that are meeting the needs of other specific populations. There's the Friends for Life organization that offers support. There is the Silver Lining Foundation. There is the MRF, which is the Medical Research Foundation of Trinidad and Tobago. They are an NGO, and they are the main HIV treatment site in Trinidad and Tobago. And outside of that, there are other NGOs that offer support for persons.
Mm-hmm. And Ms. Simon,
Yolanda.
I think you wanted to add to that conversation a little bit?
Definitely. Interestingly, you should talk about Tobago Oasis, but I'll come back to that shortly. And I want to talk about, again, going back, because we're reflecting on 40 years of HIV here in Trinidad and Tobago. And in the early days of HIV, because there was a lot of fear, there was also a lot of ignorance. And the mortality rate was high. People were dying. So there was a sense of urgency. And in that, there was a lot of resources that was poured into the Caribbean, and in particular, Trinidad and Tobago. In the first decade, I would say, between the 1993, first 20 years rather, it was a watershed moment in Caribbean history. We saw the birth of the Pan-Caribbean Partnership at the regional level. As Cyrus said, we saw the birthing of so many NGOs. And again, it was all in an effort because there was a sense of urgency and people were dying. So we've come full circle in 40 years. We've gotten access to medication. We've seen clinical care has improved tremendously. We've seen, and Cyrus had mentioned all those wonderful things that are happening. But what's been happening at the community level? So let's now go back to Tobago and the Oasis Foundation. Where is the Oasis Foundation? It's in paper. You see, talked about historically the Oasis. What has happened to the Oasis Foundation? Well, in part, what has happened, it's no longer being resourced. For one thing, there are still persons who I knew who were part of the original founding members of the Oasis who are still there, but there was no succession planning. And again, I want to underscore there was not a financial commitment towards supporting the organization, towards building the capacity of the members of the community, so that in 2023 there would have been an oasis in Tobago. I'm not sure who are the NGOs on the ground in Tobago per se. Um, and maybe that would be a good thing to do some research around what's happening there. But if we swing back to Trinidad over here, as Sarah said, there's been a lot of NGOs. One in particular, Come Talk International, who continues to work, turning night into day, literally on the ground, working with community, and again, under resource. And this is, I guess, a critical point, which is a part of why we're here, is to put that clarion call for support for the community. You need to support community engagement and community participation in a real way, not only on World AIDS Day, but every day. Because this year, they say let communities lead. If we translate that into Trinidad and Tobago, and then you would see with communities, the Family Planning Association and the Medical Research Foundation of Trinidad and Tobago. But there are other communities who go further than MRF and FPA and who do work that nobody else wants to do. That's part of the struggle. And those are conversations that they are hard conversations that we don't want to have, but we need to have them. They're necessary. So very quickly, I would want to say there needs to be a looking through a different lens at who are the communities that are making a difference, support them, well-resourced, capacity development. And capacity development don't mean a two-day workshop in the week leading up to World AIDS Day. It means doing a proper planning, a proper mapping of what the needs are with milestones, deliverables, and also accountability and transparency. So it can be done, but we need to get a group of people. And again, this is not on the government. I said people, this is all of us, citizens of Trinidad and Tobago, public sector, private sector, informal economy, to come together in a meaningful way and say, let's get this done, because we can do it. Thank you.
And we're just about out of time this morning for our interview, but I still want to give you just a minute, both of you, just to wrap our conversation as we just put a little bit of focus on HIV/AIDS and just even the community work, the work of the National AIDS Coordinating Committee over the last 40 years here in Trinidad and Tobago. And we could start with Mr. Simon first.
While there is treatment for HIV, at this time there's no cure for the disease. So it is very important moving forward that we continue to have the conversations surrounding awareness. The conversations must continue. Persons have to be made aware as to how HIV is spread, how it is not spread. We must continue to have the conversations about treatment literacy for persons who may be in treatment and care, understanding their treatment literacy, how to take their medication, keeping their doctor visits and stuff like that. We also have to look at avenues whereby we can help to reduce the stigma and discrimination, because stigma and discrimination continues to be a wedge that is preventing a lot of persons from being tested, from entering into treatment and care. We also have to continue desensitization in the wider community. And the media, like you said, you all have a big role to play, because in the very early years of HIV, even though there were a lot of negative publicity, we have come a very long way. We have to differentiate what is HIV as opposed to what is AIDS. We have to continue to educate the masses, you see, because then going forward, we would like to, as Ms. Yolanda said, the goal of UNAIDS is to reduce HIV infections to end AIDS by 2030. And the only way by which we can end AIDS by 2030 is by us continuing to sensitize persons, continuing, to have these educational blitz and stuff like that. Because, as I said, HIV is here with us. We have to live with it. So we have to know how it is spread and how we can protect ourselves.
All right, and Miss Simon, just really quickly before we go.
Yes, very quickly. As we said earlier, we are into 40 years of HIV in Trinidad and Tobago as we know it. And to that end, we are hopeful to launch our first digital publication by the end of this month or early next month. And we plan to do a series between now and perhaps May, June of next year, documenting life histories, lived experiences of persons living with and affected by HIV and AIDS, Trinbagonians, about what the last 40 years have been like, and really looking to the future and what that can be. So we're looking forward to seeing those publications come out. And again, as the media, we are hopeful that you will partner with us in amplifying these stories, getting them out there, and getting this conversation going. We've started. Let's not stop here, but let's keep the conversation going.
Certainly, and I am very much looking forward to those things to come, especially talking about the experiences and so on. Definitely some things to look forward to, and we will continue to partner with you guys as we continue to join the fight as we to help the community fight the stigma and discrimination against AIDS. So thank you both for being on with us. It was definitely a pleasure this morning. And viewers, certainly it was wonderful being with you here, and thank you for joining, and we will see you again tomorrow.
Tobago updates.